I've been doing inspections quite a bit lately. We at Boulder County Public Health have many hats, and so I not only work as a communicable disease epidemiologist, but I'm also starting to do inspections. And I was at some inspections last week, and I was asking some of the teachers some questions. And so the ECE director just jumped in, and there's a crying child, and just loved that child while I could ask where the sanitizer and disinfectant was. So I see how much love and time and energy you give to those children, and we really appreciate it. So thank you so much. First of all, I always like to start with a test your knowledge question. So you can put the answer in the chat or just unmute yourself, whatever you prefer. And what do you think is the most common outbreak in ECEs? Is it RSV? Is it hand, foot, mouth? Is it norovirus? Is it pneumonia? Or do you feel like when you look at those illness logs, you have a little bit of everything, all of the above? You think it's A, B, C, D, or E? Okay, lots of people with C, norovirus. And you are correct. Well done. Interestingly enough, between 2013 and 2023, almost 80% of outbreaks in ECEs were due to norovirus.
Twice a week, and that's just
perfect. I think we need to mute one person here. Let's see here. Okay, wonderful. So 80% were due to norovirus. And I think it's important to know that because there are some updated regulations which will be implemented starting April 14th. So in 7 days. And a lot of these regulations that have been updated have to do with how can we prevent norovirus in childcare facilities. And one of the regulations that will change is that you have to make sure that your disinfectant is effective against norovirus. And so please note, if you're using bleach when mixed as a disinfectant, is against norovirus. But you'll just have to read your label to make sure that norovirus is one of the viruses that it is effective against. Question number 2 has to do with R naught. So R naught, what does the reproductive number R naught represent in epidemiology? And so it could be A, the total number of infected individuals in a population, B, the number of new infections caused by a single infected individual in a fully susceptible population. So an example of a fully susceptible population is if the entire population was not vaccinated. C, the number of deaths caused by a disease in a given time period. And D, the percentage of individuals who recover from an infection. So feel free to put your answer in the chat. Okay, we have few brave souls who have said B, which is correct. The answer is B. And the reason we are talking about this, so this is a two-part question. What is the approximate R naught for measles in a fully susceptible population? So if you had a population where no one was vaccinated, what would be the R naught for measles? Would it be 1 to 2 people? If one person had measles, how many people could they infect on average? 1 to 2 people, 3 to 5 people, 10 to 15 people, or 12 to 18 people? Lots of good ideas here. The answer is D, so 12 to 18 people. So here's an example. So measles is very contagious. So as you can see here, we're looking at the number of people that one person will infect on average is called R naught. And here are the maximum R naught values for a few viruses. So for example, if one person had hepatitis C, they could infect or will infect on average 2 people. Or mumps. If one person had mumps, they could infect 10 people. Norovirus, interestingly enough, is about 7 here. But measles, you can see, is very contagious. So one person could infect 18 people. So the reason we will be focusing on norovirus and measles today. So that's why we asked those questions. So who answers your health, ECE, and outbreak questions? That's myself, Martha Hensa, and then Si-Ning Chan, and she'll be coming a little bit later and joining us to give us our measles update. So don't sign off too early here. Okay, today,
Martha, there was one question in the chat regarding
thank you so much.
your R naught numbers for COVID-19.
Yeah, we were discussing that. It is very contagious. You know what? I didn't find out the answer, but I will look at the answer up. It's very contagious as well, but I'm not sure what the R naught is for it. And I don't want to tell you wrong. But thank you, Mandy. I'll look that up. So today we'll be talking just an overview. The updated health regulations, which I said at the beginning, starts April 14th. And then inspection tips, partnering for success. What are the required elements for you to fill out on an illness log? And if any of you are having summer camps, what are some of the important aspects to look for with the regulations for summer camps? We'll have a partner update from ECCBC and CCAP, and then Si-Ning will come and give communicable disease update about measles, and then we'll talk about the vaccine of the quarter, measles. Okay, we talked about this last quarter, but many of you have started to use the new illness report form. So Si-Ning and I created a new report form that we've been monitoring, and it takes you all 2 to 3 minutes actually to complete this form. So if you notice that you have an increase in certain symptoms, all of a sudden more children are vomiting than normal for your facility, or more children have a fever or a cough, go ahead and fill out this form. And on the form, just info that you want to have prepared about your facilities: number of children enrolled, number of classrooms, number of ill children, number of ill staff, and if you happen to have anyone hospitalized. So thank you so much for using that form. Do any of you have any feedback? Any of you that have used it? No problem. Well, many of you have, so thank you so much. We appreciate it. It makes us more efficient. I think it keeps us from bothering you a lot and asking you lots of questions. So thank you so much.
Is this form for when you've hit the threshold for reporting because of an outbreak, or just if you notice an increase in something, just to help you all collect data?
It's a combination, mainly for outbreaks. But if you're just questioning, could this be an outbreak or is it not an outbreak, then you can send it to us and we can give you some disease mitigation information with how to prevent an outbreak.
Great,
as well. So it's for both situations. Yeah, great question. And putting the link in the chat, yes, we will do that when Si-Ning jumps on. She's usually my link putter in the chat. So when she gets, we'll put the link in the chat. Amy. Okay, and then you will all get all of the slides. And so you can get the link from the slides as well. Okay, but step one, we're going to look at the revised regulations for health and sanitation of childcare facilities. And the regulations have been posted already in 2 locations, on the website and on the Secretary of State website. And a tip that I always use as well is once you have the regulations in front of you, you can do Control F on your computer. That's Control Find. And if you're wondering what is important, what are the 9 required elements in my first aid kit, you can just do Control F and type in first aid, and then it'll pop to that section within the regulations. And there's just been a few revisions, but I feel like from a communicable disease perspective, since we talked earlier that the most common outbreak in ECEs was norovirus, that what are the regulations that help prevent the spread of norovirus? And so there's a written vomit and diarrheal cleanup procedure, which is required. And thankfully, CDPHE has given us a template that you can just download and put your facility's name on it. So it's pretty easy. I'll give an example of that and the links as well. And then, like we said earlier, your disinfectant must be effective against norovirus. The third thing is that shoes worn outside of an infant classroom shall be covered or removed when entering an infant classroom. So the importance of that, I was doing an inspection of a facility about a month ago, and all of a sudden a child threw up on the floor, and the teacher wiped it up, used a disinfectant, which was important against norovirus. But I saw as she was wiping it up, her feet were tracking around some of the particles from the floor. So I think that's one of the important reasons why shoes worn outside of an infant classroom shall be covered or removed when entering an infant classroom. And then the other thing that will help prevent the spread of norovirus, and I think a lot of you knew this from what you learned during COVID, that the use of sensory tables is prohibited if a suspected or confirmed outbreak is occurring at the facility. We'll go into these 4 things a little bit more in depth. So here's the example of the vomit and diarrheal incident cleanup procedure. And the link here, I don't know if I can give you, no, I can't give you a link right away, but the link there will give you here, we'll jump to this. And this is, you can download this. This is what it looks like. And then you'll put your facility name, contact name, disinfectant name, make sure you know the contact time for norovirus, and it will tell you that on the label on your disinfectant. And with that, you'll want to have a spill kit available to quickly clean up vomit or diarrheal spills. And here are 2 people who were part of Imagine. And when I did their inspection a couple weeks ago, they pulled out what they had created for their spill kit. So there's a mask in there and gloves and things that are important. And this Purell is effective against norovirus. So, and you can either make your own, or Kara Kaiser and we had many questions. What should be in our spill kit when we clean up vomit or diarrheal accidents? And we looked at all the items that could be potentially in there, but we looked on Amazon, and for $10 to $15, you can buy spill kits. So you can do what's best for your facility, but that might be the easiest solution. And again, the disinfectant must be effective against norovirus. And then here, I think you can see why during an outbreak, sensory tables are not allowed. You can see all these kids are having a lot of fun, but they're really close. They're breathing on each other. They're touching each other. And so that's an easy way to spread communicable diseases. Okay, well, I said I would share some of the resources. And first of all, the CDPHE website has the regulations listed there. And then CDPHE also recorded a webinar on the updates. So some of the updates, they talked a lot about the whys. For example, I think someone needs to mute there. Let's see if someone can mute. I can try to mute him too. Oh, thank you so much. So, and the CDPHE webinar on updates is super helpful because they show the different things that were changed to decrease burden for ECE directors. So those are 2 things that are helpful to watch as well. And then this is the new vomit and diarrheal cleanup plan example. So one major change with the updated regs with that you will require all childcare facilities to have a written procedure for cleaning up vomit and diarrheal accidents. And so you can use these or create your own. And one of them has a graphic with it, and one of them is just the procedure. And then summer camp guidance. Some of the schools I know allow for, different day camps in their school. And so this is a helpful guide to make sure that you're meeting the CDPHE regulations. Okay, next part, let's talk about partnering for a successful health inspection. So number one, I've covered disinfectants in the past. I've covered sanitizers in the past, but today we're going to focus on the illness log. I'm going to make a quick hop to the chat. I see that, is there a Spanish cleanup procedure available? That was asked on a call with CDPHE, and Amy Gamble said she is working on creating a Spanish cleanup procedure. So I think Jane will send that out to everyone once we have that available. So thank you for asking, Mariah. Okay, jumping back to what are the required elements of an illness log? So in the regulations, this is wording taken from the regulations. So the log shall be kept to record children's symptoms of illnesses occurring among children attending the child care facility. And it shall be maintained at the facility for 2 months and be provided to the Department of Health upon request. And so every time we do an inspection, we will ask to see your illness logs. And the illness logs at a minimum should include the child's name, child's assigned classroom or group, the date and time of symptoms or illness, what you did. Did you send the child home? Did you isolate the child? What did you do? And then the date and time child was returned to group setting. And I think this last column is the one that we as inspectors have been noticing has been missing. The date and time child was returned to group setting. And the reason that's important is we want to know, is your current exclusion policy working for that illness or not? So for example, let's say a lot of children were having fevers. You were using the exclusion policy 24 hours fever free without fever reducing medication. And we noticed, the trends for fevers was increasing. We might suggest to you, to increase your exclusion to 48 or 72 hours. And of course, work with you because you know your facility the best. So that's the importance of why do we need to have that. This is a illness log that we have made. And you can see here, you need to put, this is on our website as well, the BCPH website. You can download it as a PDF if you'd like to write it by hand, or you can use it as an Excel spreadsheet on the computer and type it in there, and then send it to us if you notice a trend of lots of symptoms. Excuse me, 1 second here. And it's important that you put not only student, but also put your staff down, because especially if there's floaters, so you have one staff member that works in a toddler 1, and then in the afternoon they work in a toddler 2, that we know, was it one of your staff people that was ill? And was it a cook that was ill? And then class or group. And then we've made this hopefully that it's easier for you. You can just have little check boxes so you don't have to write diarrhea or cough or whatever. And then we like to know were the symptoms at school or when they stayed home. And then the date and time returned to childcare. We've also been noticing that a lot of the refrigerators have been low. And so encouraging people to print this out and put it on the refrigerator, and so that they have a temperature log. And the refrigerator should be 41 degrees or lower. Here are some other recommended staff education that Jane and I have looked into, and both of us has taken both of these classes. And we recommend for all your staff that they take a free class online during their own time called Everything You Need to Know About Sanitizing and Disinfecting. And in this class, they can get the PDIS continuing education credit. And then for cooks, we recommend that all of your cooks have the Colorado Food Handlers Card training. And the cost for that is $10.99 per person. And then talking about classes, we love professional development and just keeping you all up to date and just have new ideas. We also offer a lot of free classes for childcare providers. And so you can contact Kyla, whom I work with, who's also an inspector. If you're interested in learning about movement, the Farm to ECE program, and mealtime is more than food. Now we'd like to have updates from some of our partners. So if anyone's here from Early Childhood Council at Boulder County, we'd love an update.
Hi, I'm here. It's Amy Carlo.
Hi, Amy.
Hi. And I just realized I'll have to send you our new logo. We're excited to have a new logo and new brand. Hopefully some of you have seen it, but I'll have to send it to you all. We have a few updates. We're really excited to be hosting a provider appreciation event on May 7th. It will be at Niwot Hall, and I think right off around that main street in Niwot, from 6 to 8 p.m. And we'll try to put in chat, and we'll also be sharing throughout the week. And we did share in the PD newsletter too, a flyer with more information about that, because it's important that everyone RSVPs that's able to come, and it's really an opportunity to celebrate you and the incredible work that you do every day. We're also excited to have on the flyer nomination forms where we can recognize at the event an Early Childhood Provider of the Year. So we'll be presenting 2 awards, one for center-based Early Childhood Provider of the Year and one for a home-based or FFN Early Childhood Provider of the Year. And the flyers that we'll share will have nomination forms because it's a peer nomination process. And then our Early Childhood Workforce Committee will be reviewing the nominations and will be presenting the awards at their Provider Appreciation event on May 7th. And also, in addition to that, we'll be sending out a link for programs to share with families where they can write an appreciative message to their child's for their child's teacher. So we'll send out, and I'll hopefully get it in chat here too, if you would like a link that you can send to families or put in your newsletter, and they can write a message of appreciation for the teachers. And then we will be printing those out for programs and giving them to you at the event or dropping them off at your program. So your teachers can have messages from families just celebrating them and appreciating them. And then lastly, we have, or 2 more things. Our next session of our director's training series is on April 24th. And put that in chat too. And we will, I have a link in there also. We hope that some of you can attend to that. That will be with our early childhood coach, Tracy Younghall, and myself, and a chance to get together with other directors and talk about current topics and also just explore some leadership strategies. And finally, we're also, this is the last one, we will have another session of trauma responsive care for infant and toddler caregivers. That will be on Tuesday and Thursday evenings coming up in June, and we should have information about that in the next few weeks. For those of you that are interested in attending that, it will be virtual. It'll be on evenings, on Tuesday, Thursday evenings, and it'll be about 18 hours total. and you can get professional development hours in PDIS. And I think that is it from our end. And we will please be on the lookout for the flyers with information about the provider appreciation event, the nomination forms, and the links to share with families, because we really do want to celebrate all of you, and we hope that many of you can make it.
Wonderful. Thank you so much, Amy. There's a
Mhm.
lot going on.
Yes,
So
I
that's
know.
wonderful. That's wonderful. Thank you.
Mhm.
Okay, now we have a new person representing Boulder County CCAP program specialist, Serena. I'm not sure if you have any updates, Serena.
Hi. Yeah, hi everybody. This is my first meeting, so I'm really happy to be here. Thank you so much for inviting me, Jane and Martha. I appreciate it. My name is Serena. I am the business office manager for CCAP. And I'm not sure what was communicated at the last meeting. I'm not sure when it was, but I think the only thing that I would really like to share today was as of March 17th, the state had contacted all of the counties on freezes or wait lists. Boulder County is currently on a freeze right now with our program. They let us know that as of March 17th that the TANF referrals, so our clients on TANF, Colorado Works, are no longer allowed to bypass the freeze in Boulder County or any of the counties. So that means right now, as of right now for CCAP, we are any new clients coming on is limited just to child welfare. This does not affect everybody that is already on CCAP, so I just want to clarify that too. And just wanted to open it up if there are any questions.
Thank you,
Okay.
Serena,
You're
and welcome
welcome.
so much. And maybe do
Thank
you want
you
to
so
put
much.
your email address in the chat so that if people
Sure.
think of
Yeah,
questions, they can ask you afterwards. Okay,
absolutely.
thank
Sure
you.
thing. Thank you.
Welcome. Okay, and just so you get it, as long as you have your calendars out with all these wonderful activities, our next health ECE meeting, it's quarterly, so will be Monday, August 11th, and it's always the second Monday of the month from 12 to 1. Okay, Si Ning has joined us, and she will give us our measles update. So take it away, Si Ning.
Hi everyone. Yes, thanks Martha. Apologies for being late. I had some other things to do during the first half hour of this meeting, but I'm happy to be here. I know probably a lot of you have heard about the measles situation going on in Texas and a lot of the United States right now. So I wanted to make sure I gave you all some updates and was here to answer any questions that you all have. So we will get started. Feel free to throw any questions you have in the chat, or you can unmute at any time as well. All right, so I will go over a little update or a little background about measles before I begin. I know that in the beginning of the slides, Martha mentioned about the infectivity of measles or how contagious it is, but this chart right here also is another representation of how measles can spread to people who may not be vaccinated against the measles virus. So what is measles? It is a highly contagious virus that can cause severe illness in susceptible populations. Why we are concerned about it in public health is that it is highly contagious. I believe the R naught was discussed earlier today. If people are not vaccinated against measles, it can spread to many, many others and cause complications, mostly in children under 5, pregnant women, and in immunocompromised individuals as well. The way that measles is transmitted or how it's spread is through respiratory droplets. So those are those heavy droplets that when we're thinking about like COVID or something like that, droplets that can fall to the ground, land on your mouth that, can be transmitted through like sneezing or coughing and stuff like that. But it can also be airborne. So that means it can remain in the air, and measles can remain in the air for up to 2 hours. So that means if someone goes into a room, coughs, sneezes, or expels it in some other way, it can remain in the air for up to 2 hours, even after that person leaves that room. Next slide, Martha. The measles symptom profile, which is probably what you all will be looking out for when we're asking you all to help us out and keeping your eye out for any types of measles cases that are popping up. But typically, it takes around 7 to 14 days, so about a week to 2 weeks for any symptoms to appear after someone has been exposed to measles. When symptoms do appear, they typically appear like flu-like symptoms. So you're gonna have a fever, runny nose, congestion, stuff like that. Some people can have red, watery eyes. Those symptoms are pretty generalized. So we're not expecting you all to identify measles cases from, seeing a fever in a child. We know that that happens all the time. What happens after that, though, about 3 to 5 days after those symptoms appear, is typically we see that measles rash. Measles rash typically starts near the face or on the hairline and starts to spread downwards on the body, through the neck, through the shoulders, the torso, stuff like that. Typically, when people are talking about measles, they say that it's like someone dumped a bucket of measles on someone's head. So that rash starts from the top and moves to the bottom. For the measles or the measles rash onset, you will see coptic spots. Those are typically those white spots. You can see them on the left side picture there. They look like little white spots on the inside of someone's cheek, but we understand that you all are not inspecting the inside of children's cheeks very often. So we would ask you to just look out for a measles rash. Typically, what we're most concerned about is we know that kids get rashes all the time. That doesn't mean it's measles. Someone is traveling to an area where we're seeing measles, perhaps Texas, New Mexico, or internationally. That might be an indication that you might want to send that kid home to get them checked out by their primary care physician. You can always send us an email, rope us in at that point. We'd likely wait until we hear back from the provider before we start any sort of response, but it is always good for us to have that information on our radar, at least before we decide we need to activate. Next slide, please. Wanted to give you an idea of what US cases look like right now. So in 2025, as of this update was on April 3rd, so that would have been last Thursday, the CDC is reporting 607 total cases. You can see the age distribution and the vaccine status underneath that. You can see that most of them are either unvaccinated or have unknown vaccination status. So I'm going to talk about this later, but vaccination is going to be your best preventative against developing any symptoms of measles. About 12% of those cases have been hospitalized. You can see the breakdown in age distribution there. And then this is as of Thursday, so keep that in mind. But there have been 2 deaths reported by the CDC in 2025. Next slide. All right, and then I don't know how many of you, I think maybe we have mentioned this on previous calls, but I'm not really sure, but we like to follow your local epidemiologist. I will call her YLE for short. It is essentially a listserv that you can sign up for to get any updates on current public health, infectious disease information. We understand that right now the CDC is going through a transition. They are short-staffed. They likely are not updating data or aren't getting information out as quickly as they could be. We, during this time, have been leaning on YLE a lot to get more up-to-date information. We do know that the person who writes the YLE updates, her name is Caitlin Jedalina. She has an epidemiologist background, and so she is highly reliable, gets a lot of her data from other sources, like other universities, and stuff like that. So as of this morning, she sent out an update. You can see these numbers are a little bit different from what we're seeing from the CDC, but there are 636 measles cases nationwide as of Saturday. 569 of those cases are related to the Panhandle outbreak. So that is the outbreak that started in Texas. It moved into New Mexico. It's now moved over to Kansas, Oklahoma. And they are saying that there are some cases in Mexico as well that are related to that outbreak. So, it's very likely that these numbers are underreported. We're at this point, I believe on Saturday, it was announced that there's a 3rd death related to the measles outbreak as well. 2 of them are children, and we are seeing more deaths associated with this outbreak than we've seen in previous outbreaks. You can see in this chart on the right, the round black dots are the deaths that we've seen. So really in the last 20 years, we've seen 3 measles deaths associated, measles associated deaths. And then now in this year alone, we've seen three deaths associated with this outbreak. So it is predicted that we are seeing an underreporting of how many measles cases we have nationally. Of course, it could just be a statistical anomaly, but it is likely that we're getting reported less cases than is actually happening in the community. I want to make sure that you all have access to these updates as well. So we'll send out these slides later, or maybe Jane will drop the link in the chat, but you can always sign up for updates from YLE to get the most up-to-date public health news. All right, and then I wanted to kind of give you an idea of what measles has looked like in Colorado in the last 10 or so years. You can see there that we have only had a smattering of cases. We did have a case that came in, I believe, the end of 2023. So we've had a response somewhat fairly in our recent past, I suppose. But our last case in Boulder was in 2014. So measles is incredibly rare, but we are gearing up here at Boulder County Public Health. We're doing tabletops. We're getting making sure that all of our ducks are in order so that we can respond if a measles case does pop up in Boulder County. I wanted to touch on the one measles case that we've had so far in Colorado. This person is a resident of Pueblo County, so they are not, not one of the bordering counties to Boulder, but just wanted to make sure that if any of you all knows anyone that traveled to Pueblo during the time that the person was infectious, that you are aware of potential exposures that happened in the public. That is the table on the right. So if you have any kiddos that come in with a rash and they've traveled to Pueblo County recently, that's something that might raise a little yellow flag or red flag for you, to send them home and get them checked out by a doctor. The person, I believe I mentioned already, but was unvaccinated, did travel internationally to Mexico. The response is being led by Pueblo County at this moment. They're working with CDPHE. Currently, there's no response needed by Boulder County. We haven't been notified of any close contacts or anything like that live in Boulder. But those with exposures may develop symptoms anytime between March 24th to April 12th. So we still might see some cases pop up here. At this point, no secondary cases have been identified. And then there is a link to the press release as well if any of you are interested in reading more. And then I, of course, wanted to touch on what it means for you all at the ECE level if we were to go into a measles response. Of course, the most important thing is to keep kiddos out of school. So if you have a case, or I guess even an adult, we would first isolate that individual. Isolation is for the person who has had a confirmed test result for measles. We would exclude both suspect and confirmed cases. So whether they have a positive test result or if we suspect they have measles, we would exclude them until 4 days after their rash occurred. So once the rash starts, after 4 days have passed, they can return back to school. The other thing that would be asked of you all is identifying people that might need post-exposure prophylaxis. Post-exposure prophylaxis, or PEP that we like to call it, can be given within 6 days of exposure, and it helps prevent the development of symptoms for anyone who has been exposed. We will initiate contact tracing for that. However, it is recommended for all close contacts, like household contacts, anyone that hasn't been vaccinated yet, and anybody else that doesn't have any evidence of immunity. So typically that's vaccination status or previous infection or anyone that was born before 1957. And then lastly, quarantining individuals who might not have evidence of immunity, so again, don't have vaccines or previous infection, and aren't eligible for PEP or maybe have refused to PEP. Those individuals are asked to be excluded for 21 days so that we can monitor for symptoms in those individuals. And then, of course, the big question is, how can you all prepare for a measles case if it were to occur? Well, we of course want to encourage routine vaccinations. They are now expanding recommendations for 6 to 11 months old who plan to travel internationally. Those individuals can get an early vaccination. Of course, they should talk to their PCP about that and any questions that they have, any concerns and stuff like that. Anyone who is traveling to areas with spread, as I've mentioned, Texas, New Mexico, Kansas, Oklahoma, I guess now here in Will County, should monitor for those symptoms that I mentioned earlier in my slides. Anyone who has any suspicion, or definitely if you have a confirmed case of measles, should be reported to us immediately. It is really important. I mentioned that PEP window is only 6 days. It's really, really important that we get moving on case investigation and contact tracing as soon as possible so we can get PEP into the arms of kiddos, and that will help reduce the amount of people that will need to quarantine and definitely reduce the amount of people that might get sick from exposure to measles. Anyone that has any records of immunizations should be up to date, as you all know, but specifically for staff as well. Staff can also be exposed to measles and will also be eligible for PEP or may be identified as an individual who has been exposed during contact tracing. So we'd want to know if they were up to date on their immunizations or not. Make sure that you have sick policies in place, and of course, always encourage staying home when people are sick. Maintaining attendance records will be very helpful if you were to have a measles case in a classroom. If we have attendance records that are accurate, we can closely identify individuals that have been exposed. So for instance, if a measles case only went to school once during their infectious period, it would only be individuals who attended class that day that would need to be excluded or might need PEP or something like that. Of course, we would also need a way to communicate with parents if a measles case were to occur. So we want to make sure you have all of those methods of communications up to date. And then another thing that you all can help out with is making sure that infants are isolated from other classrooms. Of course, those always are our highly susceptible populations in more highly susceptible, I should say, classrooms and ECEs. And so we want to make sure that we're minimizing floaters that are floating from classroom to classroom, even between infant classrooms, because that can cause some exposure, like more exposures than if we were to minimize the floaters that are going into classrooms as well. I think that's on my slide. No, it's not. Sorry. All right. We always do a featured vaccine of quarter, and of course this one is on par. But we are promoting the MMR vaccine, which is the measles, mumps, and rubella vaccine. Martha included a really fun graph here, but in 2000, because of vaccine promotion and vaccine availability and acceptance, I suppose, measles elimination was declared in 2000. That has obviously very much changed since then, but as I've mentioned, now vaccine is going to be your first line of defense against measles in all cases. And then I think I have one more. This is my last slide about measles vaccine. Wanted to reiterate that the only way to reduce the risk of measles infection if you're exposed is to vaccinate for it. You typically get one dose after 12 months of age, and then a second dose at least 28 days after the first dose. But it's most commonly between the years of 4 to 6 that people get that second dose. Those born before 1957 are presumed immune just because of how prevalent measles was in the community at that time. And then this is the highlight for me, but one dose is 93% effective. The MMR vaccine is one of our most effective vaccines that are out that people get routinely. And the second dose, if you get it, is 97% effective. So it is very, very effective at preventing illness if you are exposed to measles. I was gonna say, I had one more note on that. Oh, PEP can, so one of the ways that you can receive PEP is through the vaccine as well. So if you were exposed to measles, you might receive the vaccine to stop the development of symptoms after you've been exposed. Any questions? I know that was a lot of information.
Thank you so much, Sining. Yes, if anyone has any questions, please feel free to unmute yourself or type it in the chat. And wonderful. Maria says, any info we can send parents?
Yeah, that's a great question, Maria. We had both school districts, actually, I believe it's just BBSD sent out a letter, basically a notification letter to parents to, monitor for symptoms, be aware of measles in the community and stuff like that. We can look at that template, and if any of you are interested in sending out information to send to parents, I'm happy to edit that as needed and get that out to you. So yeah, feel free to send us an email and we can follow up. Is the health department offering any vaccination clinics? So we do have and I didn't talk about that. It is on the previous slide. It was just that little link there. But the Boulder County does have a vaccine clinic. I believe Wednesdays it's in Boulder, and then long months are on Mondays. Is that wrong, Martha?
I can't remember either. The best thing, click on the link here.
Yeah, but you can follow that link and we'll send out the slides in a few days. But yes, so basically we do offer clinics. It is for all routine vaccinations. So, and I believe it covers children with Medicaid, any adults that are underinsured or uninsured. And then there's one more group that I'm not remembering off the top of my head that you can also find on that website link. And yes, Jane is, yeah, sorry, Jane, you're right. We sent out a similar letter to ECEs a month or so ago. And we can send that to you again, Maria, if you didn't receive it.
Thank you so much. Well, if you think of any more questions, you can email us at healthece@bouldercounty.gov or ask in the chat. Thank you so much, Sining. That was a good, robust information and up to date as well about measles. So as we end here, if any of you on the call today would like to receive professional development certificates, please email us with your first name, your last name, and your facility name to healthece@bouldercounty.gov, and you'll get 1 hour of credit, professional development credit. And then, as usual, we're always interested in what topics you would like discussed in these quarterly meetings. So if you think of anything that would be helpful for you, please email us at healthece@bouldercounty.gov. So to conclude here, thank you all for coming today. As you know, our common goal and we're so grateful that you all join these meetings and ask questions, because our goal is to help, the same as your goal, is to help prevent the spread of disease. So we want to keep classrooms open and provide healthy spaces for children and teachers to learn and thrive. So thank you so much for coming.
Martha, there is one thing that I forgot to mention that we're in the process of gathering, if anyone would put in chat, as we approach the wildfire season, which maybe there isn't a season any longer. We were interested in how many of you have a generator, a backup generator for your program. And if you have one, I haven't seen them, but if you have one, just if you could put that in chat just for us to get a general idea of are those things in existence for your schools? Oh, nice. Some people do. Yeah. Thanks for including that. That's really helpful.